Hello, I'm Nurul Athar, PMP, CPHIMS and ATAR certified, and welcome to my presentation on RHIA exam prep, Domain 4, Revenue Management, Part 4. In Part 4, I'm going to explain coding and vocabulary key concepts. Okay, let's explore coding and vocabulary key concepts. Anesthesia, CPT. The section of CPT code sets that contains codes for anesthesia. These codes are fall into range of 00, 1002, 10999 and are subdivided by both the area of the body, and that is anesthetized, and by the type of procedure being performed. Category CPT. The CPT code set is divided into three categories. Category 1, which is the largest and most commonly used, describes medical procedures, technologies and services. Category 2 is used for performance management and additional data. And Category 3 houses the code for emerging and experimental medical procedures and services. Category ICD. In ICD, the category is the first three characters of the code, which describes the basic manifestation of the injury or sickness. In some cases, the category is all that is needed to accurately describe condition of the patient, but more than often than not, the coder must list a more detailed description of the injury or illness. In ICD 9 CM, categories are three number except in case of E and V codes, which are alphanumeric. In ICD 10 CM, all categories are alphanumeric. Clinical modifications. This designation, created by National Center for Healthcare Statistics, is added to the ICD code sets when they are implemented in the United States. Many countries expand and clarify ICD code sets for their national use. The US, for example, expanded ICD 10 from 14,000 codes to over 68,000 individual codes. CMS, the Center for Medicare and Medicaid Services. This is federal agency, updates and maintains the HCPCS code set and is one of the most important organizations in healthcare today. CPT, current procedural terminology. Published, copyrighted and maintained by American Medical Association, CPT is a large set of codes that describe what procedure or services was performed on a patient. This code is divided into three categories, with the first category being the most important and widely used. CPT codes are an integral part of reimbursement process. These codes are 5 characters long and may be numerical or alphanumeric. HCPCS, Healthcare Common Procedure Coding System, pronounced HCPCS. This is the main procedure code set for reporting procedures to Medicare, Medicaid, and a large number of other third-party payers. Level 1 is identical to CPT and is used in the same way. Level 2 describes the equipment, medication, and outpatient services not included in CPT. E-codes, a set of code in ICD 9 CM that is correspond to external case of injury like automobile accident, poisoning, falls and even homicides. Evaluation and management CPT. Evaluation and management or E&M is a section of CPT codes used to describe the assessment of patients' health and the management of their care. These codes for visits doctor's office and trips to emergency room, for instance, are included in E&M. E&M is found at the front of CPT manual. Despite being out of numerical order, the code for E&M are 992012, 99499. ICD. The International Classification of Disease is a set of medical diagnostic codes established over 100 years ago. Maintained today by WHO, ICD codes create a universal language for reporting disease and injury. Medical necessity. Medical necessity is the justification of medical services as reasonable, necessary, or appropriate. Medical necessity is often proven using ICD codes. A coder would use the ICD code for a broken arm, for example, to demonstrate the medical necessity of an X-ray and application of a cast. Modifier. A modifier is a two-character code that is used to a procedure code to demonstrate an important variation that does not by itself change the definition of the procedure. These are added at the end of code with a hyphen and may provide information about the procedure itself, that procedures, Medicare eligibility, and a host of other important facets. CPT codes have numeric modifier. CPT modifier 51, for example, notifies the payer that this procedure was one of multiple procedures. HCPCS codes are having alphanumeric modifiers. HCPCS modifier LT, on the other hand, describes bilateral procedure that was performed only on the left side of the body. Modifier exempt. Certain code in CPT cannot have modifier added to them. This is fairly short list that can be found in appendices of CPT manual. Morbidity. The rate or incidence of disease in a patient or a population. ICD codes are used to report morbidity. Mortality. The rate or incidence of death in a patient or population. NCHS. The National Center for Health Statistics. The NCHS is a government agency that tracks the health information and is responsible for creating and publishing both the clinical modification to ICD codes and their annual updates. Pathology. The science of cause and effect of disease. Pathology and laboratory. The section of category 1 CPT codes that pertain to laboratory testing and pathological investigation. This section includes codes for procedures used to determine the status and root cause of patient's illness or condition. The code for pathology and laboratory are 80047 to 89398. Professional component. In CPT, a professional component refers to the services performed by a fully licensed medical professional. Radiology. The section of CPT manual that covers radiological tests and procedures like X-rays, ultrasound and oncology. The codes for radiology are 70010 to 79999. Sequela, a condition that is a result of previous injury or condition. Subcategory. In ICD codes, the subcategory describes the digit that comes after the decimal point. This digit further describes the nature of the illness or injury and gives additional information as to its location or manifestation. Subclassifications. The subclassification follows the subcategory in ICD codes. The subclassification further expands on the subcategory and gives additional information about the manifestation, severity, or location of the injury or disease. Surgery CPT. The section of the CPT manual that covers surgical procedures performed on patient. The largest and most complicated section of CPT is first category. The surgery section is divided into sections based on which part of the body the surgery is performed on, and then further subdivided based on what type of procedure is being performed. Technical component. The portion of a medical procedure that concern only the technical aspect of procedure but not the interpretive or professional aspects. A technical component might include the administration of chest X-ray but would not include the assessment of that X-ray for disease or abnormality. V codes. V codes are a special section of ICD 9CM that describe patient visits related to circumstance other than disease or injury. This includes live-born infants, people with risk or disease due to family history, people encountering health services for a specific or mandated evaluation or aftercare, and a host or other not easily classifiable situation. V codes have been replaced in ICD 10CM by Z codes. WHO, the World Health Organization. This international body, which is an agency of United Nations, oversees the creation of ICD codes and is one of the most important organizations in international health. G codes. Much like V codes in ICD 9CM, these codes describe circumstances outside of injury or disease that cause a patient to visit health professional. This may include a patient visiting a doctor because of family medical history. Okay, that brings us to the end of my presentation. Thanks for watching. I hope you would have found this information useful. If you like my videos, please subscribe to my channel. In next video, I am going to explain what is healthcare revenue cycle management.